Okay, welcome everyone to the April 15th Board of Health meeting, and I just have an introduction to read before we start. So the town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and are confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring, but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents with the chat room, which are not incorporated into public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. If you are dialed in by phone, use the *6 to mute and unmute. The meeting host will notify the chairperson of the raised hands, and chairperson will determine whether and when to allow public comment. When called upon, participants should state their name and address. Disruptive gestures from the audience will not be tolerated, and the offender will be immediately removed from the meeting. Thank you. So first off, to start the meeting, I would like to remind everyone of Maria Cryer, the nurse from Life Care Center that was the whistleblower for everything that's going on over there. And she had, I'm sure everyone has heard that she has passed on Friday. So I would just like to give a moment of silence in her memory, please. Okay, we'll continue. The first order of business is that there are 2 appointees to make for Littleton Volunteer Corps. The first one is Doug Wood of Bedford, and he has done all his application and his Corey form. So would someone like to make a motion?
I'll make a motion to appoint Doug Wood of 390 North Road, Bedford, to the Littleton Volunteer Corps.
Is there a second?
I'll second.
Okay, so we'll take a roll call vote.
Kevin Baker, yes.
Lisa?
Lisa Flanagan, yes.
Mike?
Michael Zeldin, yes.
And Louise Nichols, yes. And we have also Jessica Cronin of 660 Boston Road, Groton. She has filled out her application, but her query is pending, that we can appoint her with a pending query. So would someone like to make a motion, please?
I'll make a motion to approve of Jessica Cronin at 660 Boston Road, Groton, to the Littleton Volunteer Corps, pending her query.
Is there a second?
I'll second it.
Okay, and then we'll do the roll call. Kevin?
Kevin Baker, yes.
Lisa?
Lisa Flanagan, yes.
Mike?
Michael Zeldin, yes.
And Louise Nichols, yes.
Thank you all.
Okay. You're welcome, Alex. So I would like to get updates from some people that are on here. Is Scott still here? Yes.
I'm here. I don't know if maybe Jim might have a better update. since they're dealing directly with the facility on a daily basis. You may want to start
Okay.
with it, and then if there's any questions, I can chime in after.
Okay.
Thanks.
Jim Garepi?
Sure. So I just want to mention that we are still participating in daily phone calls with the Life Care Center, with the staff, and on the calls is a representative, at least one DPH representative, typically the Bureau of Healthcare Safety and Quality, and sometimes an epidemiologist from the state lab. So those calls are ongoing, and their primary purpose is to provide Tamara with information she needs to be able to do the isolation and quarantine work that the Board of Health is required to do. So that's our primary focus on that. But obviously, any other concerns Tamara tries to bring up at those meetings with the state. I don't know if you want just the rest of my update, or
I'd like to do the rest of his update.
okay. I wasn't sure if Scott had anything more to add with the Life Care Center.
As far as Life Care Center, in regards to fire department, we've been there a couple more times. We are starting to find that some of the negatives are now becoming positives. I guess that's kind of expected, you know, as things may still continue to move through the facility. And we know they're definitely still kind of struggling for some staffing assistance up there.
Just to kind of piggyback on that, I know Tamara's talking with the staff as people are going one direction or the other to make sure that there's a plan in place for them to be where they need to be in the facility. So I know when she's having those conversations, that information is being conveyed.
Excellent.
Just the kind of the rest of the update, we're getting a number of calls and I guess maybe complaint calls, if you will, about people not wearing masks where other people think they ought to be wearing masks. And at this point in time, the masks are still just an advisory. So we're explaining that to people. You know, typically it's stores where somebody believes somebody should be wearing masks and gloves. And we explain that the masks are just an advisory and really up to the individual. And we explained that, you know, gloves, that unless somebody has really good hand hygiene and they're not touching their face anyway, that the gloves are there really to protect the individual. But if they're touching their faces and their mouth and nose and stuff like that, it's really, the gloves are just an extension of their hand. So those are the conversations we're having with people who have called with those kinds of complaints. DPH this morning, I guess the governor announced that DPH is going to start providing, in addition to the other data that they're providing on the website, they're going to be providing community specific numbers, and they're going to be providing them on a weekly basis. According to the email and the information we heard, they're going to be coming out on Wednesdays. I'll still be providing numbers, and I may try to do them daily, because somehow in some of our towns, information's getting out in different directions. I'm not sure how it's happening, but there'll be times where the weekly numbers I give, somebody will call me and say, but the newspaper is reporting a different number. And again, I'm not sure how they're getting those numbers. So I'm going to try to at least get to the chairperson at the end of the day what the number is cumulatively for the day, so that you're certainly not blindsided by numbers that may be different. And I guess that's all I have for updates.
Jim, can you speak to the when the DPH made a surprise visit to the Life Care Center recently?
We have both myself and Tamara have been interviewed by one of the surveyors, but I don't know that they've actually provided a report yet.
Mm-hmm. Okay.
Tim, you said you're getting complaints about people not wearing gloves and masks. Are those the people that are working in the establishment, or are those people that are other consumers?
It's primarily people who aren't people who are working there, and sometimes people are indignant that they're not wearing a mask. I know some of the supermarkets, and I haven't been in Market Basket, some of the supermarkets or O'Donnell's, they're putting up plexiglass shields, so the cashiers have a barrier, which to me is probably a better way to do that than having a mask. But it's typically, the complaints are that the person working there is not wearing them.
Okay. So I just wanted to bring up some important information for the people that are on in as a audience, that you may not think that the Board of Health looks like we're doing anything, but in fact, there's a lot going on behind the scenes. And in fact, if we are doing a good job, you won't think you won't think we are doing anything, because that means the restaurants are clean and the food is good, there's no issues, and your septic systems are being taken care of. So if it seems like we're not doing our job, that's actually a good thing. But I do want to say that in regard to the Life Care Center, the DPH, and Jim, if you could step in and speak to this, but the DPH is the licensing authority, not the Littleton Board of Health. The DPH is responsible to perform inspections and issue orders and revoke licenses. So that is not something that the Board of Health, the Littleton Board of Health, it's not in our purview. Jim, could you speak more?
Sure, that's correct. And again, the reason I mentioned our involvement on these calls the way I did is our role of the Board of Health with this facility right now is because there are persons that we need to work with as far as isolation and quarantine. So that's our role in the facility. But the operation of the facility and whether they've got the right infection control plans and staffing numbers, that's all part of the DPH licensing process. And it's not something that we enforce. That's DPH's responsibility.
Great. Thank you, Jim. Okay, so Jim, do you have any other updates?
I don't.
Okay. Scott?
I don't. Thank you.
Alex? Yeah, thank you. Alex, how about you?
There's a lot of activity going on with requests to respects through the Medical Reserve Corps for nursing or skilled medical professionals in a lot of the facilities around the state, and many of them have made the news. We have not been put in a position where we have been able to send any help. There's a lot of considerations that have to go in there. We only have 3 RNs in the group anyway. Other than that, outside of the medical profession, there are not a lot of requests for volunteers. So we're pretty much in a holding pattern at the moment.
Okay, thank you. I guess we can open it up to any questions from the participants. Janet, are there?
This is Mike. Could I ask a question of Jim, please?
Sure, Mike.
Thank you. I realize that according to the data, the state as a whole has yet to reach what they call a plateau. Jim, I just want to make sure that I'm reading the data correctly. The second thing, even though if we're approaching it or we go through it, has any discussion begun with the boards of health about plans going forward for, I'll use the word, opening up or basically trying to get certain vital services, more vital services and more essential jobs reactivated? And the second question is that to what extent should our board be, shall we say, looking into or beginning to lay the framework for that? Or is it strictly the governor's call and we more or less follow?
So to your first point, the numbers I look at on the state page are the number of people testing positive versus the number of tests being done. And as I've been looking at that number, it still seems to be going up. The number of people testing positive as a percentage of the number of people being tested seems to be going up still. So that's the only number that I could really kind of match up with anything to give any kind of an indication. I don't know if it's going up any faster because I haven't been writing down the increases each day, but they still seem to be going up. With regards to starting back up after this is either on the downside or when it's over, I think what we're really going to do is follow the governor's lead. He's the one who's stated a declaration of emergency, so we'll take our lead from the things that he's either allowing or not allowing.
Yeah, what prompted my question was the recent announcement that there has been developed yet another test for a diagnostic for the disease that involves using accessing saliva, and that, of course, being visualized as something that could be more broadly used. So I would imagine that if and when it emerges as a useful tool, which should come shortly, that would involve more mass testing. And I realize you may have not been through this before, but do you have any idea on how such mass testing would be coordinated from town to town?
So I haven't heard anything about the new test or when they anticipate it being rolled out. So I guess I don't have an answer to that question for you, Mike.
Okay.
I had a
Thanks.
couple of questions for Scott. If I could go, Louise?
Sure,
So,
go ahead, Lisa.
So Scott, you send out the emails with the COVID-19 command center from NEMA.
Yes. Yep.
I actually am enjoying this time off because I have time to read these things. But there were a couple of things that I found kind of interesting. And I was wondering if that is available to post on the website, town website, or something like, is that just for you?
It's all public information. It's all everything that the governor had put out that day or the previous day, depending on when I get it out. But it is everything that's from the CDC, the governor, any updates to the counts, any new guidance as far as nursing or supplies, anything like that.
Yep. So Janet, I don't know if that's something that we could maybe add to the Littleton Board of Health website, because there were a couple of things that I found were interesting. There was grocery store worker priority testing for them. There's a little blurb on that. We have talked about mental health help, and there's a 211 number that people can call to get mental health, and also domestic violence and sexual assault resources. There's a Safe Link toll-free number for that on there on different days, but lots of information that people could use maybe.
I can speak, this is Janet. I can speak to Joe. I'm not really sure how he's formulating what's going on the website, but he's the one who's doing the COVID-19 website administration. So I can speak with Joe Leiden about that.
Okay. I was also wondering, is there a way that I know we started to post the numbers as of what was it, last Wednesday? But I was wondering if there was a way that we can edit what it says on the website. If I can talk to Joe, or we talk about it today.
What did you want to change?
There were just, I can't exactly remember what it said on the website, but it talked more about just positive cases. It didn't talk about that there's presumptive cases, that there's people walking around that could potentially be contagious, and people still need to be aware of that and not take precaution, not take precautions because there's only 11 cases or there's only 70 cases. They still need to know that there are people out there that could be infecting them, even if the numbers are lower than we've expected. So I could email Janet something, she could, or the board something. Just
Jim, what do you suggest for that?
So the only thing we want to do is make sure that term presumptive positive was a term that was actually used early on when we started doing testing. When testing was first being done at the state level, they'd issue, if they got a positive test, they would call it presumptive positive, because then it had to, in theory, go to CDC to be confirmed. So that term actually meant positive at the time. The term we're kind of using for those cases is medically diagnosed cases of COVID. Some people are going to the doctor and the doctor is essentially saying, well, you seem to have the symptoms of that.
Right,
maybe they're not very bad, and so but you probably have COVID-19, and so you should just go home and kind of resolve from it. So I think I understand what you're saying, Lisa. And
Yeah, I
that
guess
isn't.
presumptive cases, I guess I didn't know what that exactly
No,
meant.
and that was, there was some early confusion. People were saying, well, why are they presumptive? And the reason in the beginning they were is that they had to, in theory, be confirmed. State lab testing had to be confirmed by CDC. Now everything that comes through is just a positive test. So if you wanted to, because even with that CDC guideline on the masks, I think if you read the guidelines, they're saying that wearing a mask or some other face coverings not meant to lighten up on the requirement or the need, rather, to social distance. It's still important to do that.
Mhm.
So if you wanted to kind of I could try to jot something together for you and see if it is what you're thinking about.
All right. The other thing too, I think is maybe important, and I don't know if the numbers of people, like you said, the numbers are going to fluctuate after 14 days of quarantine or isolation too. So people will be getting off. So those numbers are going to change too. So I was wondering if we could talk about, write about fluctuating numbers.
The cases, it doesn't mean they're infected, would be on quarantine. So I could try to provide something, and the isolation period can be as short as 7 days, depending on how well you resolve from it, or it could be much longer depending how sick you get from the disease. So that period's a little more difficult to determine than a quarantine period, which is typically starts at 14 days unless you develop symptoms, then you go into the next stage. So I can try to write something for you to address these.
Yeah, just about how the numbers will, obviously we know cases are going up because testing is being done, but cases may go down because those people that were positive or medically diagnosed are coming off their quarantine, so the numbers might go down. It's not a reason for you to lighten up on what the CDC and the DPH have wanted to do.
I can put something together. I'll run it by you and tell me if you think it's right, and then I get to Louise.
Great, thank you.
Yep.
Thank you,
That's
Jim.
all.
Yep.
Okay, so does any other board members have a question? Kevin?
I was just curious if anyone knows the amount of ICU beds, hospital beds that are currently available at both Emerson and Neshoba Valley. And what the expectation is over the next few weeks, how many beds we're going to need, and what that shortage may be, if there is one, and how we can maybe try and accommodate folks that are going to need one if there isn't going to be one available.
I guess, Jim, do you have that information?
Nope, but what I can tell you from a call earlier today with the local boards, the health districts, the state is watching that number very closely. At this point, it sounds like, and they weren't talking hospital specific, so I can't really speak to the two hospitals, but they were saying that it's a number they're watching closely with the cases that are coming in. And it didn't sound like in the call that there was an issue yet, but that's a number that they're watching closely.
Yeah, I think I was looking at some curve. I forget what the website was. Mike had actually sent it to the board. Maybe we can, at some point, I'll look at it. But it seemed like a couple of weeks ago, the peak was going to be today. And now the thing that I was looking at said May 4th would be the peak. Although it looks like we're doing a pretty good job, like flattening the curve on that resource that I was looking at. But I just didn't know, are you looking at anything, Jim, as far as like predictions, tracking where we are now and where we might be in a week or 2 weeks, or is this all just like taking current information and plotting it? I mean, are you looking into the future? Is there, an approved resource for that through the CDC? How can we get that information?
So the only numbers I'm looking at is the ones I push out to the towns and the state numbers that they provide about the number of positive versus the number of people being tested. That's it.
Okay.
So I'm not tracking models. I figure there's somebody at a higher pay grade than me that's keeping track of that, will inform us of it. So.
Okay. I wonder if we can yeah, Scott.
I know as far as Emerson Hospital, I've heard that they may be preparing a potential overflow location.
Okay.
Similar to what they've done with like the DCU Center and in Boston.
Yeah.
Just to assist in a crunch time.
Yeah.
And one of the issues that, just in speaking with other chiefs, that I think everybody is facing right now is, yes, at Life Care, we had a ramp up of issues, but all of these other nursing homes are going to start to, have similar situations.
And we know why they had their issues. I mean,
But I'm just talking in general, all of these facilities experience very similar things with, between staff and close quarters with other patients. And if a few people get it and they're, unable to be diagnosed early, there's a high likelihood that it's going to transmit throughout a facility.
Yeah.
So it's literally riding the roller coaster, and you might have a busy week or two, and it might come back down. But there are right now for the other facilities, I know Emerson does have another floor that is set for COVID patients. And as of 2 days ago, they had not started moving patients up there.
I know, sorry, Scott and Kevin, on that command center email that you send out, there are some charts about beds and what they're for ICU and other non-COVID cases. If that's might be what you're looking at, the emails that we get.
Where'd you find that on the?
We get the emails about the COVID-19 command center.
Yeah, I know. Was there a link on there that had the charts?
There's all kinds of charts if you scroll down. It's not every day that there's one.
Oh.
It was today, and it was a link, Kevin, on the bottom, specifically about beds and how many they had available still.
Anybody pull it up and share it so we could just look at it?
I don't have it on this computer.
Where is it?
It wasn't Emerson Neshoba specific either. I think it was just for the state.
Yeah, it was just a general one as far as what they had for, their overflow facilities, for their step down facilities, what they had available for beds in general.
Yeah, there's a lot of through all these links. Yeah, because I think that like as of like the what I'm looking at here is that COVID-19.healthdata.org, and you can select by state. It says like on May 1st, just for Massachusetts in general, all beds needed could be anywhere from 600 to 17,000, and there's 4,800 beds available, something like that, and then the amount of ventilators needed and things like that. It'd be great to have a more local idea of what might be needed in a couple weeks to try and thwart it.
It's a guessing game.
I know, but it seems like we're doing a good job flattening the curve. I mean, are you guys looking at data that says that?
I haven't seen anything that indicates that Massachusetts has flattened.
Okay.
It just keeps going up. I think, as Scott mentioned and Jim mentioned, we're lagging New York City, if that's what you're using as your barometer.
Oh, I was just
looking at when things supposed to. That is the theoretical period, the theoretical mark point where.
Yeah. Yeah, if there's a resource to have a crystal ball, that'd be awesome. If you find it.
That'd be a rich man.
Yeah, right.
Okay. Is there any other comments from a board member?
I was just joking, saying that the crystal ball is probably in the swap shop, but that's closed now.
Okay, we can open it up to comments and questions from the participants. Janet?
Alex McCurdy has his hand up.
Oh, right. Okay, Alex.
Thank you. I didn't want to say anything like this as official part of what I do, but I had gone to a local place that was open and was actually surprised at how many people were not wearing masks. And I understand it's an advisory and they don't have to, but it just seemed odd to me that that more people had not heeded that advice and put a mask on. It's a very unselfish move, and an important move to getting ahead of the curve on this. So my thought was, again, there's no way to mandate it, but maybe, and the chief and I talked a little bit about this earlier today, maybe something that encourages the establishments to request that patrons wear the masks.
Do you mean that you want the Board of Health to recommend it?
Well, it might have a little more horsepower than if I recommended it, yes.
I mean, I'm of the mindset to put in some sort of mandate that all store workers, at least, who are in contact with, many different people during the course of a day, wear masks as a mandate, as an employee of the establishment. Whether we can, pass that on to everybody who's out there shopping, I just don't know how you.
Well, what I observed was that the establishment that I was in was pretty good about the employees wearing masks. There were some that didn't, but it was at least 50% of the people who were in the place as customers weren't wearing masks.
Is it because they don't have them, or we can't get them, or is it because they just aren't aware?
I couldn't surmise which way it is. There's probably a lot of different reasons people don't wear them, but the unselfish reason would be just wear one.
Yeah, I agree.
Wouldn't be surprised if that does come down from the state at some point too. Mandatory masks, but providing them for people, how do people get them?
Would there be a way to supply some sort of mask like at the door of the store, and then these people take them home with them and utilize them throughout the however many weeks or months this is gonna?
Well, Kevin, if you're ready to underwrite the liability for that, go right ahead.
There's no warranties, Mike.
Oh, there are. They're implied.
The bigger thing on that is, where again, most facilities are still can't even get masks for responders and for emergency care. You're not going to get them at grocery stores.
I mean, I'm not talking about N95s.
I know it doesn't matter. And supplies are very limited. That's why people are making homemade ones. They're recommending you use a bandana.
Right.
There's a variety of cloth items that you can put across your mouth without utilizing the supply chain of masks that first responders and nursing staff and medical facilities need.
Yeah. Thing for us to do would just mandate that if the cashiers and workers don't have access to them for whatever reason, they need to have a face covering, and people going into stores need to have a face covering, whether it be a scarf or a bandana or just pull up your shirt. I don't know. But
well, the other thing, like Jim said, most of the facilities now at least have the plexiglass windows in front, so there's separation between the employees and the patrons.
Yeah,
I know that when the chief and I were talking about this, we bantered around the idea of posting signs where the establishment owner would post a sign saying, "We'd appreciate you if you'd wear a mask when you come into our facility."
Yeah.
And the Board of Health is in the position to encourage that. I don't think there's any mandate we can offer.
But that certainly would be a soft way of kind of reminding people that masks are recommended.
Okay, would someone like to make a motion to, we would like to recommend people wear masks as employees? I don't know if we can do it for the public.
I mean, I would make a motion to mandate that employees wear masks, and that entering store and business owners put up signs saying you can enter with a face covering.
I can't support that. You're starting to encroach on a whole bunch of stuff. I think that the previous suggestion, the soft sell, I think is a better one than putting out mandates.
Yeah, I think we've been soft enough for long enough, Mike.
It has nothing to do with going easy on the public. It has to do with
No, I just think
people,
somebody's got to
people,
be the
people respond to, shall we say, encouragement, as opposed to the word you must, you must, you must.
And enforcing it too.
Yep.
How is that going to happen?
I mean, maybe the store manager just doesn't let them in without a face covering. You know, it's to protect their employees.
There may be concerns about a public place refusing to serve unless the governor or someone else says this is going to be a policy that's uniformly administered across the state. I certainly, it's not that I'm afraid of it, it's just that I'm not sure we're at the point where we can do that as a town.
I believe the Board of Health has a right to do that if you take a look at the regs
Okay.
and bylaws. Jim, what do you think?
Well, emergency orders allow you to do things. I've only know of one town that has, there's the way they're using it is kind of as a strong encouragement, stating that if you go into a place, you need to have face covering. But that's the only I only know of one town that's doing that.
What town's doing it and how are they implementing it?
Again, I believe it's Salem, and again, it wasn't. They're concerned about the enforcement too thing, and unless we're going to stand down someplace and enforce it. Theirs wasn't meant to be punitive; it was meant to be encouragement.
Yeah, well, I feel like a sign, and then the manager, or whoever's standing out the entrance there at the front of the store, can certainly direct people. Like, hey, here's a handkerchief, wrap it around your face. Whatever it is.
Okay, so
So I guess the motion is to mandate employees of stores that are walk-in to wear masks and gloves, and have stores put a sign on the front saying, please cover your face in an effort to protect public health and keep our workers safe and keep you safe.
do we have a second for that? Okay. Do we want to change it to be less strong, or?
You guys tell me what you're willing to do, whatever.
But just reminding everybody what the governor has strongly recommended.
Mhm.
I mean, you can put that on the website. You can Facebook. Again, how do you enforce it? Where do you let people know that they've already heard it?
On the sign on the door.
I'm sure a manager can't spend his whole day, every day, standing at the door asking people to wear a mask.
There could be a sign though that just, people will read it and they'll recognize it and say, oh, maybe they'll just think twice. And then if they walk in without one, let them walk in without one, but maybe people will think of them, differently. Like, why aren't you wearing a mask? Like if I'm going in a store, which I don't, I would look at somebody without a mask like you're crazy right now. So, maybe we're not mandating it, but putting it out there and making people aware that maybe think twice. Otherwise, more people are going to get sick.
So which stores are you talking about, Kevin? Just the grocery stores? What about the post office, CVS?
I think
all the convenience stores in town?
Every store that's a walk-in business that people are interacting. I think an ounce of prevention here is worth a pound of cure. And I don't see why everybody's so opposed to just trying to help with a solution.
So maybe, Jim, is there a way that we can have anybody that has a license of, a store, whatever kind of store, with a sign that says, please follow the government's precautions by wearing a mask? I mean, you can't tell them that they can't come in if they don't have a mask on. But maybe like the
I couldn't.
like
Owner of a store, why couldn't you say you can't come in without a mask? I don't understand.
It's a public place. You can't.
Kevin?
Yeah.
Kevin, please let people finish their thoughts.
Okay.
So we have the reusable bags that we can't use now, but a lot of people forget them until they see somebody using them and they say, oh, I'm going to go back to my car and get my bags. Maybe people do have a mask in their car. They've forgotten to use it. Make a suggestion on the door and maybe they will go back. But you can't, I agree, you can't tell them that they can't come into the store. But it might remind them that they have a mask and that they should probably be wearing it. But that would be a sign that people would have to read. And I don't think anybody can enforce it.
So we could certainly, to all the food service licensees, we have those addresses. We could certainly send something out requesting them to put the public health message up on the door so people can see it.
Yep, but they'd have to see it. So
I like that idea.
Yes, this is Mike, is that right? I was going to say, especially the part, the list of advisory, the specific point about washing hands and using a mask all in one place. Because I think all of that's on the website.
yeah, everybody knows, I think.
Yep.
But suggest wearing a mask for protection of everybody.
Okay, so do we want to try again for a different motion?
Is that even something we have to make a motion to?
Yeah, go ahead.
What does Jim say, or Scott?
You can just tell me to put together an advisory sheet and I can mail it out to everybody. I don't necessarily need a board vote, but that's up to you.
Okay, I'm fine with that, Jim. If you could please do that and send it out to all the establishments in Littleton.
And you're looking for something that it strongly advises the wearing of masks in
Right,
accordance
yeah.
with CDC guidelines.
Yes.
Okay. I can do that.
With all your spare time, could you do that
Absolutely.
tomorrow?
We'll try to have it in the mail tomorrow.
I'm kidding.
Thank you, Jim.
Thanks, Jim.
Please give someone in the audience who has their hand up. If you can take a question from Dan Kane, please.
Okay, Dan?
Good afternoon, everyone. I have actually two things. One, regarding the mask recommendation motion or idea you just talked about. Some additional information that may be helpful. One, a quick Google search shows that Medford, Beverly, Salem, and Haverhill have all issued mandatory employee and customer mask orders enforceable by Board of Health agents, and I admit I'm not sure about Littleton's enforcement scope for the police department. I know certainly I had served in other positions in another town where the police had authority to enforce Board of Health regulations as well. That under 111, 127, you have the authority to issue an emergency order for if you identify an emergency and need to respond to that. A mask has been identified as highly recommended from the state. They are not doing that piece, but certainly as a local Board of Health, it is both under MGL as well as CMR within your scope and authority to do that if you so choose. It's actually relatively easy, straightforward, and it's already been done here in the Commonwealth. Another question about how you're describing numbers for reportable cases here on the website. I've heard a couple different versions between today and one of the previous meetings about reporting only new cases and taking cases off that are recovered. That really is going to be confusing and hard to trend or track for anyone who's trying to actually see our current status. So I can like to make a recommendation that you report multiple numbers. One, total positive cases in town. Nobody comes off. You have a total number of how many positives we've had in town. If you'd like additional information, you can do total new cases, total recovered cases, if you're actually having negative tests come back on some of these folks. So no one comes off of that total case number, but you can now also show that of that, every positive, you now have this many have recovered to give that number of kind of active cases if that's a concern. Also, total deaths as an individual running number, new deaths as a new data point. And then really we're looking at not necessarily no new case, we're really looking for that curve to flatten. We should hit a point that does not climb. That shows us when we're at the end of this process. And that's gonna be much more useful and demonstrative of what our status is than simply no new case this week, particularly with weekly numbers. That's not particularly helpful looking for trends. A lot of things can happen, as we know, in a week. So if we're going to go with one with weekly stuff, we should give as much information as possible so that people have an idea of what's going on. We talk about people panic without information. Give them the best information we have. We know we can't do presumptives. We know it's not going to capture every positive, but if you have information, we should share it. Again, information is power. Information is the best source we have to control panic. I think that's all I have. Thank you.
Thank you, Dan. Is there anyone else, Janet, that would like to have a question or comments?
I'm not seeing any other hands raised at this time.
Okay.
Louise, can I just
Okay.
speak to that last comment?
Sure, Jim, go right ahead.
So we should be able to provide you with, and the number we're providing you with now is a cumulative total. So it's the total number of cases since this has started that have been reported to us from the state laboratory. We could also publish new cases so you can see the difference with the same number on a weekly basis. So that's those two numbers we can easily provide for you. So new cases a week and then the total. As far as resolution of cases, because that's a more difficult number because, again, we're waiting for people to get off isolation. It's just not something we have a good handle on at any given moment. And then deaths, we don't get those necessarily reported to us. So that's not a number we could report on at all. So just, I can give you the total, the cumulative total. I can give you the new numbers each week. So that shouldn't be an issue.
Thank you, Jim. Okay. How about now, Janet? Is there anyone else that would like to speak?
I'm not seeing any hands raised at this time.
Okay. Are there any other issues that I think we're all set then? Does someone want to make a motion to adjourn?
I just say one thing. I know also on that COVID-19 command, they have a lot of requests for blood. I know Emerson has a blood bank and blood a couple of weeks ago. Blood has a shelf life. And so they can't have everybody, now that we're all off work and looking for things to do, give blood. They can't have everybody come in at once so they're trying to space out how often they're getting donations. But if somebody is healthy and somebody doesn't mind doing it, you can call Emerson Blood Bank and make an appointment to donate. They are staggering the appointments so that there's not too many people in the blood bank, and they're a really good. It's our local hospital. We should donate if we can. That's all.
Great point, Lisa. Kevin?
Lisa, do you know if they have a mobile operation at all?
No, I don't think so. Those are mostly, I think, blood bank. No, this is a blood bank. Those are mostly blood drives. There was some information on that bulletin or whatever that we get that talked about blood drives, but I just give it Emerson. They make appointments. They give you little goodies afterwards. They take really good care of you, and it's our community, hospital. So we should support it.
LCTV has the information. If you'd like the slide, I can send it to you on specifically Emerson and how to contact them to make an appointment.
Perfect.
There's also a list, if you plug in your zip code on American Red Cross, because my daughter and I just signed up for one in Westford in a few weeks as well. So, and they had locations all over the area to donate blood.
But don't be surprised if your appointment is out in the future, because like I said, they said blood has a shelf life, so they can't refrigerate it. They can't keep it at 98.6 and it'll be good forever. It will eventually expire and then be worthless. So.
Plus, I'm sure that the method of taking blood, they can't have a big crowd in there, so it's limited to the people that are the 6-foot rule and everything, so it's going to take a lot longer. Okay. Any other?
Yes, Louise, Alex McCurdy wanted to speak again, please.
Okay. Thank you, Alex. Go ahead.
This is it, I swear. I just couldn't go again without saying how hard everybody is working. It doesn't matter whether you're on the Board of Health or anywhere in society right now. We're going through some very difficult times, and everybody's working their heart outs trying to do the right thing. And from the first responders who are taking the risks to the people in the hospitals who are taking the risks, and families that are worried every day that they might have an unfavorable outcome if somebody comes down with it. So I just want to acknowledge that everybody's really got their heart into this.
Thank you, Alex. Okay, so if we have no other comments, I'd like to make a motion to adjourn, or someone to make a motion to adjourn.
Make a motion to adjourn.
Second.
Okay, we'll take a roll call. Kevin,
Kevin Baker, yes.
Lisa,
Lisa Flanagan, yes.
Mike. Mike.
I keep getting muted by the host.
Okay. Mike, can
Mike
you?
Zeldin, yes. All right.
Okay, Louise Nichols, yes. Thanks everyone for coming, and everyone stay healthy. And
Next Wednesday at 2.
next Wednesday at 2 o'clock. Thank you, everyone.
Yep.